start. So as innovators, we need to think around how do we solve such problems of decision-making, policy, and strengthening response, with everyone being involved right from the start. Next. Okay, so and it's still related to that. There was limited research output from the nursing department. Remember that nurses form the biggest bulk of our healthcare system, and they are always at the front line, both in the hospital and in the community. So the human resource was very inadequate. I think that is something that we all know, that you have one nurse monitoring 40, 50 patients, and if they are doing that and they have to take vital signs for every patient, interpret them and make appropriate action, put the patient on oxygen, give a drug, it is very difficult. So they were thinking, can the hackers today think around a way of remotely monitoring such patients? Is there a way that we can bridge this gap, because the resource envelope may not be enough even in the near future to make us reach the WHO required of one nurse for every 5 patients, or maybe one doctor for every required patients. And yeah, so that is part of, and even when COVID struck, the few nurses who were available, many of them now went to triage, went to emergency response, and still that wasn't enough. And the rest of the chronic care patients are left without adequate attention. So the hackers today, we need to think around more of such solutions again. Next. So now when we move towards the community, this is still both from the nursing department and from the doctors and the audience. They think that the community is not prepared for pandemics. When a pandemic strikes, all sorts of conspiracy theories comes out. We have been cast by God. Is it someone has bewitched us? This COVID, the whites want to kill us, all sorts of things. Even now with Ebola, I think you know what is happening. There are all sorts of conspiracy theories. That's because the community is not well sensitized. And so with all this, now came into the era of home care. So during COVID, the hospitals were full and people were having home care. But then it was lay people giving oxygen to patients. Remember, oxygen is a drug. And so we were trying yesterday the panelists felt that there was a lot of home care, but without health worker and nurse involvement. And so, since we are hacking today and we are innovating, we need to find innovative solutions about that. And then there's this whole program of the government where nurses and health workers do outreaches, they do mobile outreaches for immunization. Can we find a way of doing mobile nursing that we can identify patients right from the start in the community and either link them to care or manage them from the community? Still, today, that's part of the challenges that we have to hack around. Next, as we wind up. So still, there are very poor communication structures in the community. That still resonates with my previous slides, that from the health center 1, who is the village health team, to the health center 3, there's a lot of poor communication. You find patients who should have been managed at health center 3 come to the regional referral, and then the people here are overwhelmed. People with problems that can be sorted at health center 4 end up in the national referral. That is because there's a bit of a communication gap in the community healthcare system, and we need to find a way of bridging that gap so that we can be able to reduce on the strain that different levels undergo. And also, some of the information that we give to the community is very technical and in English. And even us who think we are learned, some information is quite technical for us. If I came and spoke technical terms in pediatrics and many people would be left out. But if we are able to give information in a way that even the least trained person can be able to access, I think that will give us acceleration towards universal health coverage. And also the nursing education will kind of improve because of the way we give information. Next slide. And yes, still regarding nursing, they work very long hours, they get burnt out, then they have to give a report at the end of the day, they have to update an inventory list. And so imagine someone who has worked several hours and then they have to still update all this paperwork. So can the hackers today find an electronic way of ensuring that all this is done, that the nurses don't have to, because they're already constrained, can they find a more easier way of doing this and a better way that is also centralized, so that when I come tomorrow, I don't have to read the very difficult handwriting. It's easy for me to understand the reports. And in relation to the way of managing our data. Most of the patients in chronic care still use a lot of hard copy books. And if I went to a different hospital today, the health workers won't understand, or it's difficult for them to follow. So can the hackers today find a central way of ensuring that even patients in chronic care, patients who have maybe been attended to in pandemics, have a central way of having all their information in a central system, that any health worker in the system, maybe if you go to a different health facility today, tomorrow you go to a different one, they can kind of access all your information in one platform, and there's continuity of care. And so that is part of the challenges that we have today. And so this came out very strongly from the doctors who work in the community health facilities. The cost of healthcare is very, very, very high. Some facilities have been very innovative and they have insurance schemes, but still the people at the base of the pyramid, the poor of the poor, cannot access some of these services. There is a limit. And so you find there are no premiums of, say, 1,000 shillings, 2,000, and even the legal framework to start some of these community groups and insurance is also difficult. So we need to find ways of ensuring that everybody gets the minimum health care package. And that is part of the challenges that we have as hackers today in this era of emerging pandemics. I think I should be coming to the end. We have talked about this. Still, the budget allocation and the infrastructure, both resource and physical, is very little, to the fact that our population doubles almost every other few years. But then, as we think about these solutions, I'm sure we shall come out with very brilliant ideas at the end of the day. Thank you very much for listening.
Thank you so much, Dr. Moses. And to the hackers, you know that when you do something, everyone will wonder which person did this, which person did this. I always share it with my people who deal with herbal medicine. When you do something, they're like, which doctor did this? So if you're a good doctor, they're like, there's a doctor who did this. But the Africans spoiled it and said, which doctors? It's not which doctors. They're just wondering which person did this. It's just a surprise that which doctor, not Dr. Barija, like a medical doctor. Then we Africans spoil everything and say which doctors are spoiling things. No, herbal medicine is real. Hanky, am I telling the truth? That is a herbalist. Now, you realize that is the way we are going. Thank you so much, Dr. Moses, for the highlights. Let's be the best in whatever that we do. Allow me to welcome and recognize the next speaker, who is going to give us insights about innovations and intellectual property. We've found problems of who owns what after the hackathon. If you win as a team.
I will take you through this small presentation on intellectual property and innovations. Like I've said, I'm Luwama James Tony. I come from URSB, which is an autonomous government agency. We are led by the Registrar General, and we have a number of values, transparency, accountability. We should be moving to the next slide. Accountability, integrity, professionalism, etc., etc. Next slide. It's a little slow in the interest of time. So in terms of services, we are most known for business registration. The Registrar General is also the registrar of companies, sole proprietorships, partnerships. Then we also have civil registration, that is the registration of marriages, licensing places of worship to conduct marriages, conducting civil marriages, especially in Kampala. Outside Kampala, it is usually conducted by the cows. But for us, we are restricted to Kampala. Then we also deal with matters of insolvency. When companies have issues, we also come in. Our famous example is the UTL, where we had to come in to be able to support them, and probably because of our interventions, that is why we still talk of UTL today. Had it not been the case, probably they would already be out of action. Then we also have a simple registry, still on the other slide, where traditionally we access credit by using fixed collateral, that is land, fixed property. But the simple registry, which is security interest in movable property, this was after the realization that people use a lot of collateral, but using mobile property. You use a car, you use your laptop, you stake your laptop to be able to get a loan here. But now here, we have this simple registry to avoid somebody using a car and getting 10 loans, which may not even be equivalent to the 10 loans. So in this case, when somebody gives you a loan and you stake the car, it is registered. And a person who is going to give a subsequent loan should be made aware that already you've staked this mobile property. Then what we are going to focus on today is the aspect of intellectual property, which are creations of the mind. And we can go to the next slide, where we look at ideas, looking at the summary from the highlights from yesterday's engagements. You can be able to get so many ideas on how we can be able to provide tangible solutions. But these ideas, before you can talk about IP, have to kind of be refined, come up with solutions, which solutions we can now be able to change our communities. So how do we convert these, very many ideas from the different teams that we have here into solutions that will be able to impact our communities? Next slide. So intellectual property refers to the creations of the mind. I doubt if any people here are going to give us creations from their feet. And what am I trying to say is that everything that these people are able to come up with can qualify for IP. So intellectual property rights are exclusive rights. They are not rights for you to implement, but they are rights to exclude others from implementing your idea without authorization. So for example, what that particular statement means is that, for example, if you get IP, it does not mean that you don't have to follow other requirements. For example, if it is something where you might be required to conduct clinical trials, yes, you have the IP, but again, you also have to fulfill those other requirements. And we emphasize the fact that IP is territorial. So when you have protection in Uganda, that means you have protection in Uganda. If you find that this is an innovation that could probably be relevant to other countries like Kenya, our neighbors, then we have mechanisms through which you can be able to seek for protection in those different areas. And of course, URSB is the National Intellectual Property Office. Next slide. So the number of IPs, and even before we begin to hack, I strongly believe we already have IP being generated, like you'll see. Say we have the trademarks, the copyright, the designs, trade secrets. Then we also have the emerging fields, such as the geographical indications, and then the traditional knowledge, where most of the aspects, for example, the herbalists, you'll find that they fall under that aspect of traditional knowledge. But even before we have a law on traditional knowledge, you find that some of the aspects of traditional knowledge can fit within these existing structures. So the first category is literary and artistic works. Whatever we drew, you remember the faces we drew for our neighbors, that qualifies for copyright protection. And you have copyright for whatever you drew. Address the long hours of our nurses. The moment that process becomes clear, then you begin venturing into the patent system. You begin venturing into the utility model system. So if the processes and the products become clear, then you are beginning to talk about the utility models. You are beginning to talk about the patents. Now, when you do further, when you work that invention further, and then you begin asking yourselves, how do I enter into the market at the end of the day? Most of the things that were showcased yesterday, some of them are ready for market. So you find that at that point, begin asking yourself, how am I going to identify my product in the market? And this is another very interesting thing. You'll find that if a medical device has been invented by a gentleman called Lubwama, they struggle as much as possible to ensure that their name appears. But there are so many very brilliant inventions without necessarily revealing the names of the inventors. Because if I insist that this device, good as it might be, has my name Lubwama, does it make sense to people, probably outside the central region? If it does it really have a lot of meaning to the people outside Uganda? So we really support these inventors through Mbarara University, through Camtech, to ensure that we come up with very good trademarks, which can really position our invention. So trademarks, industrial designs, that is what happens if you move along the innovation value chain. So some of the benefits, they help you to position yourself. Of course, if you are innovative, if you are inventive, it helps you to position yourself, and it makes you competitive. So the IP system helps to ensure that our innovative ideas or products or services are adequately protected. It increases visibility, like it was clearly indicated yesterday. Through these hackathons, through the invention, through the innovations coming through these exercises, you clearly see that we are positioning ourselves, for example, as a university, we are positioning ourselves as Camtech, we are also positioning ourselves as participants in these very good competitions. So ideally, it should also be able to help you distinguish your business and products from those of the competitors. Next slide. Just going a little deeper into what trademarks are, these are just signs that are meant to identify and distinguish goods and services of one entity from those of the other. Using the example of, for example, MUST, yes, we have a number of universities in this country, but when you look at their logo, you can't, confuse it with any other, in as much as we have so many universities in this country. So that relates to the different entities, that relates to the different products, that can relate to the different services that we offer. Those are just examples, and I'll just give the example. I'll just elaborate more on the issue of Sandrop, which is one of the products which came out of this very engagement. I don't know which edition it was, but at least it's already on the register, and it was one of the very active products, at least during the COVID pandemic. And we appreciate this, we appreciate Camtech and MUST for such initiatives. For purposes of how do you file, this is something, like I said, we may not be able to exhaust it here, but be comforted that should you have a trademark through Camtech, through Mbarara University, we can guide you on exactly what this is, give you ideas on what a good logo or what a good trademark might be. So you obtain an e-copy of your logo in JPEG format, and then you pay the fees. That is the search fee and the application fee, and then we apply. It is fully automated, and through that, the moment you log on, you will be taken through the steps, and you'll be able to have your application filed. Then after you've filed, of course, we examine to confirm that what you've submitted is not already on the register. It qualifies, because there are also some requirements for protection, but that's a detail, but just know that there are some requirements. Then there's also, after you've gone through the formalities, you'll be required to publish in the Uganda Gazette, but we also have a URSB journal in which you'll be able to publish your mark. And if nobody opposes the mark, then we go ahead to issue you with a certificate of registration. Next slide. So those are the fees. Search fees 25, application fees 50, then registration fees 100,000. Next slide. Then the copyright, like I said, you are already creating a lot of copyright, and you are the owners. For purposes of proving ownership, we advise that you register, so any publications around your inventions will automatically qualify for publication. Most of the software applications will also fall in this category. Next slide. So you apply to the registrar, accompanied by 2 copies of the work for which registration is applied, and then at a later stage you'll be required to publish your application in the Uganda Gazette. Remember that for the trademarks we have an option of the URSB Gazette, but because these are different laws, we haven't yet provided for a copyright gazette that is URSB based, so we still use the Uganda Gazette. And if nobody opposes, you don't even pay extra fees, and we shall be able to issue you with your certificate. Next slide. Those are the fees. I've already alluded to that. The application fee is just 50,000, and probably the publication fee, which is paid to the Uganda Gazette, of 350. But after that, you don't pay any extra fees for us to issue you with a certificate. Then next slide. Industrial designs. Like we said, that for purposes of entering the market, you will need to kind of package your product. One of, is it the photo what? Photo cabada, yes. And he tried to explain how he was really interfacing with the medical personnel and said, no, but this thing it looks like a real cupboard. You don't want to really subject this thing. It's a very good innovation. But at the end of the day, in appearance, it looks like a coffin. It will not look very good if you put in your children. So I said, no, you change here, change here. So that kind of alludes to how this is going to be packaged and how will it, appear to the person who intends to buy this product. That is why industrial designs are very important. Because ideally, a phone is meant to communicate between point A and point B. But you buy a phone and then somebody says, this looks more or less like a feminine phone. But ideally, whether feminine or masculine, it communicates between point A and point B. That is how people are able to expand their market, by using the design system to ensure that some of their products can appeal to children, some of their products can appeal to women, but functionally, it's basically doing the same thing, but for purposes of expanding their market. Then we talk about what everyone claims their invention to be. Everyone with a logo, they will come and say, I have a patent. Everyone with a journal say, I want a patent. So this is an exclusive right granted to an invention. And an invention is technical solution to a problem. It should be technical in nature. For example, technical in terms of reducing heat loss. Technical, there should be a technical problem for which you are providing a solution. So in terms of requirements, for anything to qualify for patent protection, it should be new, it should be inventive, and it should be industrially applicable. Industrially applicable just means it has use. It can be applied anywhere. On inventiveness, it just means you've added knowledge. What we usually hear from campus, what have you added to the body of knowledge? So that is how we measure inventiveness. And then novelty is it has never been disclosed anywhere. And this is where I really want to emphasize. Many people come to apply for patents when they've already disclosed their inventions in so many forums. Of course, engagements like these are kind of protected, especially if somebody applies for their invention within a specified period of 6 months after disclosure. those are some of the examples, and I use the example of the safety pin. The focus should, because people try as much as possible to make their solutions the most technical. Let the problem be technical, but let the solution be the simplest. And that is why we keep emphasizing the issue of the safety pin. At the time when jiggers were a serious problem, that invention did wonders. And that is why you find so many industries around that invention. For the case of Uganda, we as engineers, we have a problem. Say, what kind of engineer are you who can't even manufacture a safety pin? But at the time when that safety pin was novel, it did a lot of wonders, and that's why you find so many Chinese companies which made billions and billions of dollars just around that simple invention, because the problem was big, the solution was simple, and did a lot of wonders. We have the example of the matoke, because everybody, each time you come to the west and all over Uganda, you find matoke. And then a good professor goes and says, the problem with matoke is it has a short life and it's not stable. So somebody comes up with something to stabilize the matoke, and they can increase the shelf life of that matoke to about 6 months. And the man is minting dollars. Simple solution for a big problem. And many times, even when try to explain to people, what is the inventive aspect around this? Even many people in Uganda here don't accept. Why? Because they look at it as a simple solution. But somebody is able to make exports. You may not even have gotten a chance to see this on the Ugandan shelf, but he's making a lot of money in Europe, a lot of money in the US. Then the utility model. These are usually improvements. You'll find that some of the things that you work on are more of improvements to what is already existing. So our role as URSB is to basically establish what improvement have you added to what is already existing. And we ensure that you have adequate protection for that. This is something related to what also, Camtech and Barara University have been able to work on, that the so-called vein locator. And I think this was already filed with us. So it is something that anybody could take to be as simple, but for us, what do we look at? Somebody, have you used different components? Is it a simpler process? So we try to establish what you've done, and we ensure that you are adequately protected for that. That is the utility model system. That is just in terms of fees for the patents, application 100, like that. Then the trade secret, especially given that we work in groups. And we have people who say we are keeping a secret, so they tell Professor or Dr. Data, this is a secret that I'm telling you. Then they go to Professor VC, I'm telling you a secret. So before you know it, this is one individual that has a secret that has been told to 20 people. So you ask yourself, is this indeed still a secret? But in terms of IP, there are some aspects around your invention that may not fall in any of the categories that I've listed. It's not a trademark, it's not a design, it is not a patent, it is not, any of the things copyright. But you find that it is helping you to implement your idea. So we choose to keep it as a secret. And like we say, you don't even need to disclose this to us. So you keep it as a secret. Because for you, you know at the back of your mind that you can't get this if you don't have this information. The famous example is the one for Coca-Cola, and we give it everywhere. The other is KFC. Because all of us eat chicken. We try to really make it as crispy as KFC, but nobody has gotten the KFC formula. And that is why probably it has become a very big thing, just because of the trade secret system. But in our case, if there is anything, before you know it, it is all over the place. So it goes to how do we manage these secrets for us to transform them into big business ideas. So we go ahead. This is another very important slide. Trying to explain that for us to effectively protect our invention, you'll find that you may need to use more than one form of IP. For example, I said all publications that you make about your invention will qualify for copyright. If it is a new process, if it is a new product, that process or product qualifies for patent. Not so? And if you are to enter into the market, then you say, no, this is my photo, Kabada. So that is a trademark. So many people get comfortable when they protect one. Somebody makes a publication around their invention and they think they are covered. That only gives you copyright protection. So if I don't go and use the information you put in your publication and I attribute it to myself, but I go look at the process and implement. If I don't just go and just photocopy or attribute what you did to myself, I've not infringed on your copyright, but I can as well exploit all the information contained in that research for free. So you find that you need the technical aspects, protect them using the patent system. The branding aspects, protect them using the design system, the trademark system. Of course, the publications that you make will be protected using the copyright system. And other aspects have to be kept as a secret. Yeah, we have the routes for protection because remember I indicated that protection is territorial. Meaning if you come to URSB under the jurisdiction of the Republic of Uganda, you have protection in Uganda. What happens if you want to have protection in Kenya? Ideally, you would again have to move to the IP office of Kenya. But we have systems through which you can be able to do that. By coming to Uganda and you indicate that you want protection in Kenya, you don't have to fly to Kenya. Some of our inventors have done that mistake. They go to as far as going to Zimbabwe, where the regional office is. Yes, you apply through the regional system, but that application can be filed with us. That is, for example, if you want protection in Uganda, so you use the regional system. But there are also circumstances. You say, in our group, we worked with somebody from Canada. We worked with somebody from the UK. Chances are high that these people go back and they actually protect these inventions which were initiated from here. So you might need to choose the international system of the World Intellectual Property Organization. And I heard the MC rightly recognizing our partners. So you have to use the international system. But again, Uganda is party to that international system, and therefore, you just have to file that application with us. You don't have to fly to Geneva. Probably it will save you some of that per diem. But you just come to our office in Kampala or even our office in Kamkuzi. We shall be able to offer you that support. Next. Yes, as I come to conclude, I talk about the Technology Innovation Support Center. And of course, we have a Technology Innovation Support Center at MUST. That is supposed to be MUST. I don't know why I put much. I think it's because we receive many applications from MUST. So one of the most active, we are very happy to report that it's one of the most active in Uganda. We've received a number of innovations from this Technology Innovation Support Center. And through this center, we offer you free advice. How do you access this patent innovation? Of course, after like today, how do we accelerate this process to ensure that this becomes a good product, it becomes a good service? We can support you on this to access patent-related, of course, the non-patent-related information. Most likely, you already have your resources, but patent-related information which could aid you in coming up with a good and faster innovation. So we support you on that. Then we support the teams in coming up with the applications. We support you because we know this is something we are not actually meant to do. But we know we have capacity challenges in our country. So we support you on that. How would we come up with an application? What information is relevant to this? You have a lot of information. But what information is relevant for a patent application? So we guide you on that process. Then we guide you to look at the different forms. Where do I apply? Where do I need to go? Because it has cost implications, and we don't want this to weigh you down. So this is an area where we again support you, but given the program for the day, these are matters we talk to. You just engage all these people, Dr. Data, Nuriat, and all these people of Camtech. They know how we do this. We wish you all the best, and thanks for the opportunity for being here.
Thank you so much, Dr. Tony. By the fact that you're in Bara University, we have, by the powers and the Vice Chancellor is there. You're now Dr. Tony after that presentation. Thank you so much. And the idea, the problem is big, but the solution should be simple. That is what we've gotten. This is the product from Camtech, Sunny Drop. And Dr. Data promised that blue is for boys, he'll make us one for girls, which is pink. But I don't know when it's coming out. That is the same product. And at this moment, I now invite him to come and tell us those details, to speak on behalf of Camtech Uganda, and explain to us, like lay people, what maybe even a hackathon is, much as we are here. Some of us are here because we saw the advert, or we are here because we know Camtech is an international organization. Dr. Data, please come and speak to your people.
The Vice Chancellor, Mbarara University of Science and Technology, and your top management representatives, our Councillor, Mr. Wafula, who is our Councillor at the Embassy of Uganda in Burundi, the mentors, and our partners in this journey. Gonzi University, URSB, the Ministry of ICT, Ministry of Science, Technology and Innovation, Vilgro Kenya, and Uganda Industrial Research Institute. The list goes on and on. We are very honored that you could be here with us. This morning, Camtech Uganda celebrates 10 years. In Uganda, we are regarded one of the most innovative and entrepreneurial countries, but the mortality of most of our initiatives is so high. So we are so happy that Camtech Uganda celebrates 10 years today. And I just want to present to you our 10-year journey. I know I shared this 10-year journey at the cocktail yesterday, but so many of you were not there. Permit me to share this journey again. So, the origins of Camtech Uganda started in 2011, when a team of students got a call, went to one of their lecturers, Dr. Elena Turiachika, and said, can we partner together and respond to this global call for innovations? It was the Saving Lives at Birth Grand Challenges for Development. And from that call, Mbarara University was listed among the top 77 applicants to that call. We got a lot of publicity as an institution, but many people did not know who were behind that application. And that application, though we did not succeed, USAID and partners flew us to Washington, D.C. to defend our application. We didn't succeed, but we learned a lot. But that application led to Camtech Uganda being in. The Global Camtech Uganda was being formed in 2011, and when we featured in this USAID and partners saving lives, this 10 years celebrates our partnership with Mass General Hospital in the path for innovation. We are very grateful, and Dr. Simwe, please convey our gratitude. So we started in 2012. By 2014, we established the Innovation Lab, and after the Innovation Lab, we started the journey on a very different trajectory. It's good to have ideas, but the best thing we learned is that ideas that are not embedded in an innovation ecosystem and governed by processes don't really accelerate towards the market. And so I'm very thankful to the management of Mbarara University for giving us the opportunity to establish a physical place called the Camtech Innovation Lab in Mbarara University. We would have never achieved what we are proud of without that physical place. Thank you so much. So for our 10-year journey, we looked at what we have been able to achieve. And so in the innovation ecosystem, we categorize our support to innovators into 3. So there is the pre-lab support, in-lab support, and post-lab support. And just for the interest of our impact, we did not feature how we have been able to touch lives in the pre-lab support. For example, just this year, we have so far supported 44 teams in the pre-lab. And out of these 44 teams, 15 have already received funding. And that is about 33% success rate. But for this 10-year journey, we wanted to look at what impact has it been for teams that crossed into our in-lab support program and post-lab support program. And so we did a survey to look at that. And we followed up 25 teams for the Camtech at 10 report. This survey looked at a few success measures. And we were measuring our success in terms of the total amount of funds raised, the jobs created, the number of the intellectual property filed. We also looked at partnerships created and how many companies have come out of this. And I would like now to report on these milestones. So a total of 25 teams were surveyed, and those were the teams that passed our project qualification review, which is very rigorous to cross into the lab. Out of these 25 teams, 10 companies have formed. And these companies are registered in Uganda, and they are doing business in Uganda, creating jobs and contributing to revenue in this country. We are pleased to report that. We looked at how many jobs have been created out of this 10-year existence. The total count came to 216, with almost an equal number of males and females employed. And from just the Camtech team, just imagine we had 10 Camtechs in Uganda. We will be contributing significantly to the unemployment challenge that our nations have. In terms of intellectual property, and I really want to recognize and applaud our relationship with the Uganda Registration Services Bureau. Just like their title says, it's a registration service. In terms of national recognition, our work has attracted both national and international recognition. We were so happy to be nominated to represent Uganda, and grateful to the government of Uganda for supporting us to showcase prisms at the Dubai Expo. And so we have been able to receive national recognitions and international recognitions. Just in 2021, in the peak of the pandemic, one of us in the Camtech team was recognized by a university that even we did not go to. We have never set foot in that university. Rice University nominated one of us to receive their annual Global Award for Excellency in Innovation Leadership. If we look at the total number of studies we have done, because we believe that for science to be adopted, it has to be evidence-based. We have been able to conduct a total of 33 different studies from all the teams that we have been able to work with. And these 33 different studies really are poised to provide the evidence for the innovative work that these teams have been able to engage in. And I think that contributes to our global ranking as a university of science and technology, but also our contribution to science. So we are grateful for all the teams that have been able to work with us to position themselves to contribute to science, but also contribute to the global rankings of our institutions in Uganda. Now, to the money. We believe that innovation needs to have the three pillars: impact, technical feasibility, and commercial viability. And for any idea that we propose and we try to support in our team, we ask the teams, is this going to be impactful? Is this going to be technically feasible? And is this going to be commercially viable? And they need to answer all these what? These questions. And answering all those questions means you are going to do studies, you are going to do research, and you need food in your stomach to also do the technical work. So we are laser focused in supporting the teams to fundraise. And over the 10 years, we have been able to realize that we were able to attract up to 15.5 million US dollars. That's about close to 60 billion Ugandan shillings to come into this innovation ecosystem. And that is the money that created all the jobs that we have been able to talk about. All the partnerships, facilitate all the partnerships and the studies that we have been able to talk about. And so if you prorate it, it's about 1.4 million US dollars that have come on an annual basis to Mbarara University and to all the innovators that plugged into the Camtech innovation ecosystem. We are so indebted to all of you, our partners, and especially the management of Mbarara University. It has been a very interesting journey, and it has been a journey which has not been without challenges. Sometimes we go home and you lie on your bed and ask yourself, why are you doing this to yourself? Challenges are beyond us. And we come to the lab and say, guys, what are we actually doing? Should we continue this? But then it's from the feedback from into this innovation ecosystem that tells us, yes, we are touching somebody's lives. Because in Camtech, we really believe that as human beings, we are created to be useful to others. And as long as we are positioning ourselves to be useful to others, I think that is where true happiness comes from. True happiness, we believe, is from the thank yous that others tell you. But us as individuals, we do not control how we feel. But how people treat us greatly influence how we feel. So thank you so much. I'm so indebted to all the people who have burnt the midnight candles in Camtech, Uganda. So Nuriat, I don't know where you are, Martin, and the entire Camtech team, thank you so much. NITA Uganda, by the way, Vice Chancellor, I didn't tell you this. There was a time when the total amount of internet that goes to Camtech Uganda alone was equals to the total amount of internet that Mbarara University gets. And that is because of how much the Ministry of ICT believed in our work. We said, look, we need to innovate, but we need to know what is out there for us to be able to know what has been done and what has not been done. Our problem is internet. They gave us 100 Mbps, upload and download, for free. And up to now, they provide Camtech internet for free, not shared with Mbarara University. And that's how much NITA Uganda has supported the innovation ecosystem in this university. We are so grateful to NITA Uganda. So thank you all. That is a journey that we hope you will be able to come and partner with us, and let's continue the journey. The road is rough, but I think with all of our collective wisdom, we can be able to achieve more. So see you at the 20 years anniversary of Camtech Uganda, because if we don't reach the 20 years, it's because you did not allow us to reach there. If we don't celebrate the 20 years of Camtech Uganda, it's because you did not allow us to what? To reach there. So it's all up to me, and it's all up to you individually. Let's think about this, and let's work together, overcome the barriers, and continue this journey. And let's hug each other in 10 years from now and celebrate more milestones. I thank you so much.
Thank you so much, Dr. Date. And I'm surprised you spoke for that long. He always speaks for 1.5 minutes. That's the problem with scientists. Ladies and gentlemen, as we're getting ready for the next speaker who is online, allow me to welcome and recognize media houses here present who are making us visible both with print media, digital media, and online. In the house with us, we do have a team from NTV, and that is Mr. Encore Deo. Thanks for being with us, NTV. We do have a team that traveled all the way from Kampala with Madam Hope Mafaranga. Please stand up for recognition. And the social media persons. If they don't stand up, they're not doing the right thing. Yes, the team that came with Madam Hope, please stand up. Yes, those are the people responsible for the online. We do have a team from Vision Group. This includes TV West, Radio West, Bukede TV, and New Vision. They are with us here present. We do have a team from Barra University social media platforms, and please stand up. Social media persons. It seems you're tweeting the wrong things. Okay? Yes, thank you. We do have AYIT TV. Ladies and gentlemen, AYIT TV, please stand up. AYIT stands for Empowering, why are you seated? Empowering Youth in Technology. And these are MUST alumni. Yes? They came up with the technology during the pandemic. Please clap for them. And let me tell you why you're clapping for them. I want free things so that the next event I don't pay. These people have put us on the map in terms of marketing the university and bringing the public within the university. They interview people who have succeeded, and through their technology, we do appreciate that they bring the community closer to us. Sankara Biaruhanga is the director. I've promoted you, don't worry. And then Ronald Tushabe also is a master alumnus who did Bachelor of Computer Engineering. And the others are also still students here, but they're with us. Thank you so much for innovations. Strictly also, we do promote innovations in different faculties. Recently, Dr. John Obongoroch is Obongoroch, are you around? Yes, please stand up. Yes, you're in an orange t-shirt. He's the Dean Faculty of Applied Sciences, and they are the first. Okay, why are you clapping? Because he's the Dean. Now you're going to clap for this one. He is spearheading the team that is developing an MRI, the first of its kind, that is going to solve problems in Africa in terms of bills. That's why I expect you to clap, not because he's the dean. Dr. John Obongoroch is heading that team, and we're having support from NIH. Thank you so much, Dr. Jones. We do have with us one more other person. We do have a student who did wonders also in the Dubai Expo, and this student was mentored also by someone who is here with us. That is Mr. Muavu Rogers. Rogers, are you around? Yes, these people came up with an app that deals with, he came up with an app with his student called Okello Patrick, and this app classifies the soil and also suggests suitable crop growth of particular problems. So it is under artificial intelligence, whereby the students come together with their mentors and do something that promotes both the university and the country. So the hackers here present do not feel like you are left out or you're missing out. I'll borrow the words of my professor, Professor Kazova, who said, even if your project doesn't go through, you are still winners. Go back to the drawing board and find out where you failed and then start again. He did a project that was affected by the pandemic, and for 2 years, he kept on pushing, and it went through, and he won a grant of 10 years. Ladies and gentlemen, at this moment, allow me to welcome the presenter of the the person giving us the keynote, who is supposed to be Dr. Amina Zawede, the PS Minister of ICT. She has sent someone online, and that is Dr. Chitogo Fred, the principal of Uganda Institute of Communication and Technology. He is going to be online, but I'm told in the audience we do have someone who is from from the Institute. Please stand up for recognition. Someone from the Institute? Yes, you changed the t-shirt, please. Thank you for being with us. And Dr. Frederick is online. Ayit, please take on. And thereafter, we shall have remarks from the Vice Chancellor, and we'll divide up. Thank you. Dr. Fred, are you there?
Good morning. Good morning.
No, that's
And thank you very much, moderator. I hope I'm being heard clear.
Yes, you are.
Okay, thank you. I've been introduced. I am representing the Permanent Secretary of Ministry of ICT and National Guidance. Let me start by making some salutations. The Honorable Minister of ICT and National Guidance, PS Minister of Health, the VC Mbarara University of Science and Technology, Country Manager, Camtech, all the MDAs represented, including, but not limited to, Minister of ICT, Science, Technology and Innovation, URSB, NITA, and others. Fellow presenters, the mentors, the judges, the innovators, participants, invited guests, the press, all protocol observed. I bring you warm regards from the Permanent Secretary for the Ministry of ICT and National Guidance, who is unable to be with us due to other duties that have come up before this event, but also in the light of her being away already as the event is going on. I would want to first of all thank the persons that prepared this event and all of you, the participants, in all your categories. Let me start by giving a presentation outline. I'll give an introduction, talk about a little of social and economic development and innovation, and then the interventions that have been undertaken by the Ministry of ICT and National Guidance on behalf of government in this space. And then we shall go to a conclusion. In light of the understanding of the ministry and how to focus, how innovation is going to facilitate or help socioeconomic development, we have started by giving a brief understanding of what we want to mean by socioeconomic development. And this is really, in simple terms, improvement of people's lives through number one, improving education, improving incomes, skills development, and also employment. So it's a process that identifies both the social and economic needs and addresses those needs in a practical, in the best interests of the community over a long time, over a period of time. So now getting to what actually innovation is, we classify innovation in 4 main categories, but are looking at ways of using technology to create more efficient organizations, services, improve alignment between technology initiatives and business goals in simple terms. So we are looking at product or service innovation, and then process innovation, also paradigm and business model innovation. You know, the way we make money, improving the way we make money. Then also position innovation. The 3 main focus areas that we look at, what is desirable to users, what is visible in the market space, and what is possible with technology. So when we are focusing on how government through the Ministry of ICT is going to position innovation to facilitate socioeconomic development. Those are the dimensions that we look at. To make our understanding better, is we notice that innovation is everywhere, and it's a driving force that pushes our society into the future, where new ideas are increasingly and becoming the central theme for social and economic development. To be able to ground innovation to support social and economic development, we first of all look at the country's strategic direction, which is the Vision 2040. We note that the Vision 2040 talks about how we want to get there. Some of the fundamentals are infrastructure, human resources, science, technology, engineering, through to engineering and innovation. Whereas the opportunities include, amongst others, those areas that we need to innovate in: tourism, agriculture, health, minerals, oil and gas, industrialization, knowledge, and ICT, geographical positioning, abundant labor force, and water resources.
Can't sit for long. And we all know that F stands for female and M stands for male, right? Deal? The female is right? Now, you see you're tired. The female is right? F.
Of ICT started on positioning innovations to support socioeconomic development. The first one is by engaging. This one such activity is engaging, but several other activities, and then providing systematic and sustainable support to national ICT innovators. I will talk about the details ahead. Then to promote ICT products, services, and solutions, to establish and operationalize ICT innovation parks, hubs, and other centers, and then to promote local electronics manufacturing and assembly. So those are the 5 that have been identified and begun to be worked on in terms of positioning innovations to support socio-economic development. Some of the flagship support and innovations include areas around infrastructure, where we have had a national ICT innovation hub developed, internet bandwidth provided, national data center services to enable innovators and other players in the ecosystem to access services. And then solutions and direct support, as previous presenters have alluded to. The Minister of ICT has provided direct funding to innovators and innovation hubs, and supported also innovation hubs through having memorandum of understanding to facilitate, amongst others, a provision of funding, but also mentorship and other services, as well as consumption of the innovations. Amongst the innovations that have been supported and have come to fruition, I will start with those ones under the National ICT Innovation Hub and directly under the NIS program. That's the Electronic Records and Document Management System, National Products Barcode System, Communications and Collaboration System, that's a COCUS. It's like a virtual system like Zoom we are using now. It is being piloted at the Uganda Institute of ICT. So we are soon going to roll this out so that we don't use Zoom anymore because it doesn't have licenses attached to it. The data is stored in the country. We have the e-poster, we have the land management system, electronic government procurement system, which is being piloted in government, education management system, which we are all aware of. We have supported, amongst other hubs, RunLab, MIIC, Camtech, being a big hub that has been supported, Outbox, Hive Collab, TechBuzz, and then we have had specific support to MAST and the Camtech, and we are very proud for the innovations that have come out, such as Prisms, MobiCare, Sim4Like, and then Airlight Vein Locator, amongst others. So those are some of the flagship projects, but we have also supported other universities like Guru University and the Mountain of the Moon, and also other universities in addition to MAST. You need to know that innovation doesn't come with any challenges. We have identified some together with the innovators and the innovation hubs, but we are yet to continue having a SWOT analysis being undertaken, and we shall do this jointly to, amongst others, identify the strengths, the challenges, opportunities, and threats. And then this will guide us in objectively coming up with the strategies to improve the support that is being undertaken in a guided way for innovations to support social and economic development. Amongst the challenges, we noted that acceleration of business processes and shortening of business life cycles remained a big challenge for the innovators and innovation players. The markets are volatile and they have varying customer demands. Subsequent small innovations due to extreme time pressure. There is a lot of pressure on innovators to churn out innovations quickly. So that makes them produce small innovations instead of looking at the big picture. Another challenge is integration of products and services, where innovators tend to try to integrate the products and services, which is what is required in the market. So they're having challenges in those areas. They normally come up with just products on one side and services on another side. Of course, there are image problems, as well as financial issues, not having enough finances. And then, of course, quality, which is very, very paramount in terms of the consumers taking on the innovators that have been churned out by the different innovators. Quality is of utmost importance. So these are the few areas that have been identified beyond the normal issues that we already have, like space and infrastructure and all those. So these are additional challenges that have been identified.
Thank you so much, ladies and gentlemen. At this moment, allow me to invite the PS of Ministry of Health, who is represented by the Director of Mbara Regional Referral Hospital. It's my pride and honor to say that Dr. Atwine was in Mbara University and has just given a call to Dr. Barije, who was also in Mbarara University. So, and those who didn't hate us clapped for us that we have only the big shots.
Yeah, thank you very much. The country director, Camtech, Uganda, the Vice Chancellor, Mbarara University of Science and Technology, distinguished guests, ladies and gentlemen. I'm called Dr. Barije Celestine, the hospital director of Mbarara Regional Referral Hospital. I'm here to represent the Permanent Secretary, Ministry of Health, Dr. Diana Atwine, who was supposed really to be here this morning, but because government engagements, as you all know, the current situation in the country, she's not able to be here with us. She called me and she sent this speech, which I'm going to read verbatim, because these are the words which she would have used herself. Therefore, I'm here to represent the Permanent Secretary, Ministry of Health. I thank you very much. It gives me much pleasure today to be the chief guest at the 8th Camtech Uganda Medical Technology Hack-A-Thon event here at Mbara University of Science and Technology. I'm glad that Hack-A-Thon event brings together participants from different disciplines to develop innovative solutions to global health needs, which embrace the One Health approach. Based on this year's theme, which is building a resilient healthcare system in the era of emerging pandemics through innovation, the Ministry of Health, being at the front line of managing emerging and re-emerging epidemics, requires innovative approaches to handle such occurrences. As you are all aware, Uganda has experienced significant disease outbreaks. You have not forgotten about COVID-19, and now Ebola viral disease, yellow fever, Congo Crimean fever, and others. So, and most recent outbreak of Ebola viral disease in Mubende region, which was confirmed on the 20th of September 2022. These disease outbreaks have been managed by bringing all experienced technical officers from all sectors with support from development partners, implementing partners, and through strengthened healthcare workforce. As a Ministry of Health, we drew lessons from outbreaks of COVID-19 in the country together with the partners and development partners and implementing partners. Government agencies and academic institutions also, and a couple of innovations to manage the outbreak were developed. Let me mention 3 innovations that were developed as a result of this. One, you all remember the EpiTent was developed in response to West African Ebola outbreak. The EpiTent is a portable hospital adapted for Uganda's against COVID-19. Given several key features that made it suitable for use in places with an upsurge of infectious diseases requiring hospitalization, the tent could easily be assembled and deassembled for medical staff and patients who live and work in hot and humid climates that are common in Uganda. We actually have one of the EpiTent which was given to Barra Regional Referral Hospital, where some of you who have never seen this can actually see. There is the Blamu ventilator. This is a low-cost ventilator, was also designed in response to the COVID-19 pandemic and beyond to bridge the insufficient oxygen levels in the country. We thank the innovators. Thank you for that. There is the pedal tap. Emphasizes the importance of hand washing. Hand washing may be taken as a simple thing, but it is not as simple as you may think. It is like the other safety pin. So hand washing and hygiene to prevent the spreading of infectious diseases. The pedal tap is affordable, durable, water dispensing device connected to existing water systems or drums to control water taps for hand washing. Additionally, digital platforms like school-based surveillance were designed to link coronavirus data between the education and health sectors using the district health system, the DHIS2. It was challenging for students to adhere to standard operating procedures in schools. Hence, the SBS platform was instrumental in managing COVID-19 cases in schools and establishing referral system for COVID-19 cases within the school and to address the information gap. I thank the people who actually developed these digital platforms, which were really very, very happy. You can clap for them. Apparently, with the recent outbreak of Ebola, in Mubende region, such innovative platforms are highly needed to contain the current and future epidemics. Within a short period of time, I'm glad that this innovative hub brings together all disciplines to work in the holistic approach to enable the country to move in tandem in all disease response efforts. I look forward to hearing from the developed innovative approaches to curb global health needs from this event. I thank you, Dr. Diana Atwine, Permanent Secretary, Ministry of Health. Usually it is not good to adulterate a speech of your boss, but as a director for the hospital, I shouldn't leave this platform without saying anything. I just want to say one thing, that for us as Barra Regional Referral Hospital, we have benefited a lot from this Camtech and innovations. Mostly in the areas of infection control, we have an incinerator which was developed by Makerere University, which does not use fuels, but uses plastics which come from supplies of the hospital. So you put some of those things in the incinerator, and then you burn. Of course, it may not burn everything to ashes, but you reduce the volume of the what? Of the infectious waste, which we can now take to another incinerator to be burnt completely. That is a very, very big innovation. Therefore, I want to urge you here also to look at that incinerator and you see how you can improve it to have higher temperature so that we can actually burn these things completely to ashes. The other thing I wanted to comment about the Vice Chancellor's speech, thank you, the Vice Chancellor. You talked about when you are grazing and you looked at the good goats and good cows. We have the challenge of inbreeding. There are some innovative farmers who actually would know how to get the he-goat or even the bull to get good breeds out of that. And that is very important. If you don't, and you have inbreeding, everything will what? Will vanish. Our African innovators here were able to tag what we call among the humans, like in Uganda they have names. Rubwama is one of them. I know you belong to a certain clan. Now that clan cannot marry from certain other clans. Why? Because they were able to tag you that name, and therefore they were trying to avoid inbreeding. But these days we have tended to even think that that was useless. But as doctors here, you know that when you have inbreeding in a society like this, it can actually lead to extinction. Therefore, I'm also urging you to think about the different clans we have in Uganda and why they are there, and maybe we tag them electronically so that we can eliminate the element of inbreeding in our society. I thank you very much, and I say this for God and my country. Thank you.
Thank you, Dr. Celestine. Dr. Johnzo Bongoroch, in just 2 minutes, whereby you've already started the 2 minutes, please introduce to us the mentors, and thereafter we shall have Madame Nuriat to give us a brief, the rules, the judges, the everything about the hacking. Thank you so much, Dr. Jones. You got it?
Thank you, Angela. And I want to thank Camtech for this opportunity once again for people to come and hack and find solutions to our clinical challenges. I am a teacher also, so I know normally from telling from the eyes of the students when it is time up. So when I look around, I can see some eyes and I can tell that I have 3 minutes only. So I'm here to introduce to you the mentors, and my work has been made a little easy. When I look at the placards, I see clinical mentors, business mentors, and engineering mentors. So I will introduce you along those lines. The mentors are mostly in yellow t-shirts. Some of them have probably not yet gotten the t-shirts, but they will get. And those of you who will need mentors, look for the yellow t-shirt. Orange, oh, looks yellow to me. You see? It's yellow. Exactly. So could I have engineering mentors? If you are an engineer of any sort, hardware, software, can we stand up, please, and wave to our mentees? Let them see your faces. Please mark if you need anyone in engineering, you look at those faces. Can we have our clinical colleagues, clinical mentors led by the director of the hospital, clinical mentors, pediatrics, ops and gyne. Yes, so those are the clinical mentors. Business mentors, please. Business mentors led by the Vice Chancellor. So if you need business mentors, those are the people who will mentor you. There are those mentors that are probably not listed here. Those who, I don't know how you would call them, that help people to form groups. Those are the type of mentors that we will also need here, because you will find a very brilliant engineer who doesn't want to talk and doesn't want anybody else in his group. So we will need those mentors as well. And then also those who will mentor them to present what they have. Some people will have very brilliant ideas but cannot articulate them. So we'll need those other kind of mentors as well. So if you are here, please avail yourself and let's hack. I thank Camtech and I wish you the best weekend ever. Thank you. Angela, you have 1 minute.
Jones, this is my flow. Ladies and gentlemen, before the presentation of Madame Nuriat, please look in front of the person in front of you at the back who has a t-shirt. That is the hashtag. Follow the hashtag, and if you're on Twitter, please just retweet or please comment. We need to see the social media flooded with the Hack-A-Thon of Mbarara University. Please follow our social media platforms, Camtech Uganda and Mbarara UST. And there are other social media personnels. Please follow them individually, but use the hashtag. It's #healthcare hack 2022. Thank you. Nuriat, the floor is yours. And read the people's faces.
Okay, thank you, Angela. It's time to hack. DJ, this is the hour that we have all been waiting for. What brought us here? Please let us stand up. Everyone stand up. Stand up. Stand up. It's time to hack, yes. Some dancing, let us share.
Lead me to my destiny.
Mentors, please, because you're going to mix up with the innovators. Angela, you need your help.
For the champions, for the champions, stand up. Stand up. Stand up. For the champions, for the champions, stand up.
No. DJ, roll it. We are going. What I do is what I do. Yes, now that's where we go for Hababa. Do you have Hababa? Please. They are rewarding here. They are rewarding. In fact, you stand on the chairs. If you break them, we are innovators. We can always, you dare step on them. Okay. Okay, DJ, roll it. Arms up. Are the first innovators. They recognized Whipple. Who has told you to sit? Hey! Whipple, please stand up. Whipple, all of us stand up. Property. Can we write that word with our bodies? Capital letters. W, go. Down, down, down. Up, down, down, up. That is Z. You people in blue. We are repeating because of you. That was Z. W again, down, down, up. Slant it a bit. Slant it, down, up. Okay, I, down and up. P, down, that kind of thing. Now you see where your heads are going. Those are mirror numbers. P is that way, down, down, up, there. Okay, we, po. O, we're doing O, down. Got it.
Thank you so much. A very big hand clap for Angela and everyone who was here. Okay, this is the time, my presentation. So what I'm going to do is to take us through what a hackathon is, what we are going to do right from now. What are we doing? What is expected out of, from now, what is next? Yes, okay. No, please, the first. And it will take about 5 minutes so that we can start then. Okay. All right, thank you so much. That is Hack-A-Thon 101. Next slide. Of course, we have welcomed you already with a dance, with the speeches, and now we know we are ready to start hacking. Next. So this is the process. We start with pitches, mixing up, hacking, feedback, iterating, and finally, we will have winners. That was communicated to you all. Next. What does a medical hackathon look like? Okay? So we'll have pitches. If you're shy, this is not the right place that you should come to. So we are going to stand up right after this presentation, and Dr. Ochola, you should get close here. We will stand up and pitch. In 1 minute, you tell us what you want to do. Not what you want to do, the challenge that you're interested in. In 1 minute, after 1 minute, we will have a timer. We clap you off the stage. Next. After presentation, before this, we will go and, after pitching, we will go and register our pitches. There is a room next to this one. There is a team that is waiting for you to register your pitch. And then we start, before that, we start mixing up. Like I said yesterday, those of you who attended the business workshop, the design thinking workshop, you cannot innovate as an individual. Innovation is best when you have a multidisciplinary team. So you need to convince people to join you. Of course, some ideas, some challenges will be dropped. Depending on how you convince people and how good your challenge is, people will join you and then you start innovating. So you need to have that skill of making sure that your challenge is good or it's a winning challenge so that people join you to work with you. But when you work together as a team. It becomes your innovation. It becomes your idea as a team, not the person who pitched. Next. Now the hacking begins. We have mentors. They will be moving around. But you start because we are running out of time, so you really need to start hacking, developing your idea. Next. Of course, it continues. There are stands on your tables. What these stands do or help us to do is, if you need on your table as a group, if you need a clinical mentor, you raise it, and the clinical mentor will walk to your table. If you need a business mentor, any mentor that you need to guide you at that time, maybe you're stuck, please put that up. and they will walk to your table. Next. We will have mentors, of course, giving us feedback and guiding us on, what we are developing. Next. That will continue. Next slide. Presentations will begin. Tomorrow, we will start presenting as teams what we have been working on. Of course, judges and then the mentors, the judges will be listening and awarding, and then we will sort out. They will be sorting out. We are not part of that process. But presentations, that means you have to prepare your slide. And the slide is, I think, 5. The PowerPoint is 5 slides. And then you have to do pitch practices. There are minutes that will be given to you, and you have to work within those minutes. Next. What are the do's? There are do's and don'ts of hacking. There are things that are acceptable. There are things that you should try to avoid. So what are the do's? Open yourselves to crazy ideas. It is okay. Those of you who attended the evening session, we said it's fine. Have crazy ideas, and out of those crazy ideas, that's when you come up with the final idea that you want to work on as a team. Seek diverse teams. I have already mentioned that. Reach out for help. The mentors are there, and they're identified by the T-shirts and the name tags they are putting on. The strings are white. Okay? And then, fail. Allow yourselves to fail first and take a second chance. It is okay. Iterate, pivot. It is okay to fail and, improve on what you're working on. Focus your problem. Try to focus the problem. We said yesterday that the problem is key. Try to identify and define the problem very well, then you can move on to the solution. So focus your problem. Don't say, we are looking at pregnancy and then babies and, make sure that you focus on one single problem and seek advice. Start building. We have a hack store. It is full of materials, prototype materials. If you need any other materials, please reach out to us. There's someone in charge. Where is Martin? I think he's in the other room where you'll be doing pitch registration from. But if you need something and it's not in the hack store, you can request and they will go get it for you. But there are other things we use, like simple prototype materials. Next slide. What are the don'ts of hacking? One, do not worry about patenting at this stage because it's just an idea. So do not worry about, if I present my idea, they are going to steal it. That is going to tie you up at this stage. I think, you mentioned that in your presentation. Then do not discuss ownership. Because I'm the one who presented, so this is my idea. It's not good. Please try to avoid that. Even when you're presenting, use we, because you're working as a what? As a team. I know there are people who said, I came with my solution. I came with my idea. In a hackathon, you don't come with ideas. You come with challenges. Or you pick challenges. That's why we conduct a clinical summit. That's why we shared all these challenges that we shared with you, because we went to different health facilities and talked to different stakeholders who gave us challenges. So we compiled and shared with you. If you check on that link that we shared, there are challenges, but we never shared solutions. So if you came with a solution, you're in a wrong place. Okay. Then do not develop too broad of solutions, like I want to develop something that should work there and then. It's a prototype which can be improved later when you come, if you would like to work with us to improve on your solution and to provide you with support, we can do that. Do not be negative. Do not be shy to share in your groups or present. Do not monopolize the conversation. If you're working as a team, allow everyone to contribute. So we don't want to see people who are monopolizing. They are the ones who want to talk. They want their ideas to be taken up. That is wrong. Do not only talk. Take action. Do not talk and, this is how we want to develop the problem statement. Please take action, because we are looking at hours to tomorrow, so you need to take action. Next. Pitch sessions, 1 round of problem-based pitching, of course after mixing up, so there will be the pitch sessions. Next. The problem pitching, 60 minutes, no slides, that is the pitch presentations, what you're going to do the pitching here after my presentation, and Dr. Ochola, he will give us an example. So it's just pitching a problem, and he will show you how to pitch a good problem and if you're pitching a bad problem. So he will give us 2 examples. A bad pitch and a good pitch. I beg your pardon. No slides, tell a story. You can quantify the problem, like you have some statistics maybe, but in only 60 seconds. Next. Then identify, so what are some of the tips to pitch, pitching a problem? 1, identify high pain problems. Look at problems that have, have affected people, that have high impact, that where you can, help save lives. So look at high pain problems. Next. Identify terrible experiences, not cool technology. So do not look at, yes, I have an interesting technology, it works very well. Please focus on terrible experiences or, problems. The problem should come out well first before you can actually start looking at your solution that is cool. Next. Problem pitching, tip 3, imagine, like how can you use those statements? He'll give us an example. Tell a story. Next. That is our Twitter handle, and feel free to, tag any other institutions that you want. But we have a team there that is also doing a good job. Next. Slides for final presentations. So in your slide, for the final presentations tomorrow, you will have a problem or need section, which is given 1 minute. Then you will have, you can also give like some statistics or an example. Next. Then you will demonstrate the solution. You will have a slide or the section, a section that talks about your proposed solution. Okay? Remember, the solution comes from the problem that you have defined. So you look at the solution, and then you can do a demo. You will do a demo. So if you're talking about building something, please use any available resources to make sure that you have something that you can demonstrate, not just reading slides or telling us this is how we would like to build our innovation. We need to see, the judges will want to see what you're proposing as a solution. Next. Business model, okay, the commercial viability section, how do you intend to make money out of your solution? That can be another, that will be another section. Next. The judging criteria, this is what we are going to give to judges, and this is what they will be using. It looks at the challenge, the first one, the challenge addressed, which should be well defined. The public health impact, of course, that is all into the problem statement. The innovation that you're proposing, they look at whether that innovation will work to solve what you're proposing will solve the problem. What is your business model or sustainability model? How do you intend to make money out of this solution? What is your team? How multidisciplinary is your team? Will it have the capacity, the capability to build what you're proposing? So you need to include your team and any partners. It can also be another small section. The pitch demonstrates the prototype, then clearly articulates the problem, the technology proposes to address. All that I have explained. Next. That's the end of it. Thank you so much. If you have any questions, I'm not going to... yes? It's for judges, but we'll guide you on the different sections because it's a judging criteria. I just took you through all the sections that I mentioned. There are 5 sections, I think, 5. The problem, the solution, the business, how you make money, your team, partnerships. Those are the sections that we look at. And every partner you include in your write-up, tell us why you want to partner with them. You don't say, I'm partnering with we will partner with Ministry of Health, and you don't know how and why you want to partner with them. So any institution you put, you have to make sure that you know why you want to partner with them. Thank you so much. I would like to invite Dr. Ochora to give us an example of a good pitch and a bad pitch. Thank you so much.
Thank you very much, Nuriat. Should I start with the bad pitch or the good pitch? I start with the bad pitch. Okay, so I'll pitch the same problem twice. I'll start with the bad pitch and then the good pitch. I don't know if I have a timer. It should be 60 seconds.
Can someone time for us? Yes. Because 60 seconds, after 60 seconds, we will clap him off.
Okay, Dr. Data is timing. Should I start? Good evening, everyone. My name is Dr. Ochora Moses. I'm actually a doctor at the referral. I'm very happy to be here. All of you guys are very, very, very smart today, and I'm happy for what Camtech is doing. Now, I actually have a solution that if I could make like a call center whereby if an accident happens, like if an accident happens, you just tap on the button, and then, okay, that happened to me this morning as I was coming from my home to here. I was on a border, and then there was a truck in front of me, and he abruptly stopped, and then the person behind actually got off. Now I imagined if this person, for example, breaks their leg, and they don't come to take care of them in time, what could happen? Maybe they could die. But then I was there and I was stuck. So I want now, can I have 30 more seconds, please? Okay, I wish I had 30 seconds. I would tell you what I was going to do. I don't know if that is a good pitch, if you understood. Would you give me your money? Really, but there's a problem. Okay, you can time me for a good pitch. So more than 4 million road accidents happen every day, every year in this country, and many of them are potentially fatal. But most of them don't get response in time. And by the time they reach the hospitals, the patients either die or they already get complications. I'm looking for a team that will enable me to hack around this solution so we can reduce on the response time for emergencies. Thank you very much.
Thank you so much, Dr. Ochola. So that's a good pitch. Now, what we are going to do, can we get someone, I want 2 people from the audience. Someone to pitch a good pitch, not a bad pitch. Everyone can pitch, anyone can pitch a bad pitch. Just one example, then we start. I need Ivan. Sorry? Okay. Dr. Data is guiding that we can start the pitching session. I need Ivan. He has the numbers. What is going to happen? We will give you numbers. You will line up here. People who are interested in pitching, who have challenges, you will line up here. We give you a number. You stand up and you pick it. Pitch after pitching. Then you continue. They will direct you to the room where you're supposed to register your pitch. Are we ready? Are we ready? Okay. So, can we stand up without wasting time? This is the hour that we've been waiting for. Ivan is here. Ivan, please stand here. Who is taking number 1? We need a second microphone. Who is helping us time? I need someone to time. Who's going to help us time? A timer that has an alarm. Yes. Okay, Rama is going to do the timing, and it should make. Then we clap the person off after 60 seconds, we'll clap him off. You don't need to time yourself. You're not going to do this. Put your phone down, please, and then pitch.
Okay, so he needs to indicate for me.
Okay, wait. Okay. Please start.
Okay, I'm Basima Job, a psychiatric clinical officer in Buyende district. And the challenge I have is handling mental patients, especially those suffering from epilepsy, because I've found out that more than 80% of my admissions in the mental health clinic are diagnosed with epilepsy, but I cannot identify the specific type of epilepsy that the person is suffering from. So I need a team of people who can support me, maybe like those who discussed the MRI, the low field MRI system, and those who can help in like childhood challenges, especially to fight intellectual disability, because when someone suffers from epilepsy, it leads to intellectual disability. Thank you.
Thank you, Jacob. I would like to interrupt the program a bit since the PS is leaving. Let's have photos with the different categories. Can I have the mentors to come forward? Mentors, please. Let's have a group photo. And the Vice Chancellor and Mr. Tony Luwama. Mentors, please come. Dr. Data, please come and take a seat here. Now, mentors, you're wearing orange, which is Jonesy's yellow. So, and you're behind an orange background, which is yellow. Mentors. Yes, you're putting on yellow. Thank you, my photographers. You ready? Oh, Vice Chancellor, maybe at the end. There's the other side. Yeah. Dr. Data is giving you his seat. Professor, Father, my sins are forgiven. Please go the other side. You're not seen. Yes. I think let one other person sit. You're not seen. You go the other side. You're not seen in the picture. Camera guys, are you seeing everyone? They are not smiling because they are mentors. Please smile. You're scaring the mentees. The mentors. You're too serious for me, Banai. 1, 2, 3, give me a smile. Yay! The director didn't smile. I got the smile. Thank you. So let me have the different categories. Engineering people, please come forward. Mentors, you can take your seats. The people seated, please stay seated. Vice Chancellor, I would request you to go to the director there. Yeah, go there. Go and sit there. Please, let's have the people in blue t-shirts. Okay, maybe you don't know your categories. Blue t-shirts, those who can fit. But I had requested for the engineering category, please, time. Engineering category. Nuriat, can you sit? There's no lady on that panel. I don't know. Gentlemen, please. Let me just balance the agenda and sit here. Nuriat, please go and sit there. You people, Dr. Obongoroch, which color is this one? Which one? This color? Black. Now, those in Dr. Jones is black. Some of you sit. Don't fear those hot seats. We are going to do it. You don't all have to come. We shall do 2 categories. Okay, guys, we're going to do another category. You're not in the picture at all. Yeah, you're not in the picture at all. We're going to take you next. You're covering this guy. They can go behind. You can go behind? Okay, cover that space. There's space there. My relatives, you come in front. I mean the tall ones. Yes. You stand there. Yeah, squeeze. Time, guys. Push in. Okay? Ladies and gentlemen, most of these are students. And those who are new, I'm told yesterday we had guild elections and the winner is Bill Clinton. We have a president called Bill Clinton. And that is only found in Mbarara University. The president of Mbarara University is Chiwede. Next category. Next blue t-shirts. You should have been here. Organizers, I don't want to call you. Next category, please. It's not every day that you find the vice chancellor with the director and the PS. Blue t-shirts in 3, 2, 2.5, 1. Yes, what's the name of the guild president of Mbarara University? They have forgotten. What's the name of the guild president? Bill Clinton. And what's the president's name? You change the question, they fail. Please push up, we can fit. Guys, let's push up, push up. We have 2 lines behind. 2 lines behind, 2 lines behind. We can fit. The tall ones, you can extend behind and let's... Guys, we can't waste a lot of time here. Organizers, are you ready? That's why you're organizers. You're ready all the time. You're not in the picture. You're not in the picture at all. Push in. Okay? Your students, you're not looking in your boss's heads. Can you look forward and smile? Why aren't you smiling? Students, you know those poses. Selfie moment. Selfie. Yes, you see the girls at the end, how they are posing. Okay, organizers. Dr. Bongoroch, which color is this one? Engineer Jones. Which color is this one? Purple. Color purple, go there. Color purple. Your nursery teacher should not be paid. Naomi, you should be in the middle. Or at the end, this side. Oh, I'm part of this team. I had forgotten. Naomi is at the end, please. No one is after Naomi. And organizers have the best smile. Cool. Thank you so much. Thank you so much. Nuriat? Back to work. Okay, please, I'm sorry, I'm guided. Stay seated. I'm sorry. Just have another seat. Yes, let's have Annette, please. Ronald and Rama, please go there. And then let me have 3 volunteers in the black t-shirt of Obongoroch. Volunteers. And mentors are already there. Please, let's time. Just we're picking a color. We don't have the blacks. Go behind. Yes, and the ones who are not shy came faster. There's no ladies. I feel like changing the t-shirt. We need a lady. We need a lady. Just hold on. Ladies. Hey. Yes, thank you. That was fast. Continue. No sleep. Wake up. Kabai. Wake up. They're not smiling. Oga, smile. Thank you so much.
Okay, thank you. Thank you.
All right, thank you so much. Thank you, Angela. We get back to pitching. Let's have our lines back. The cues. Hello. Ivan, where are you? Ivan, please come here. Yes. So please come. We continue with our pitching. You pick a number here. Please don't talk about your solution. Please avoid talking about the solution.
Good afternoon to you all. Katogume Prosper, Bachelor of Medicine and Bachelor of Surgery, Year 4 at Timbara University of Science and Technology. 20% of the Ugandan population have a sickle cell trait, and annually 33,000 babies are born with sickle cell disease, of which 80% pass on or die before crossing the age of 5 years due to failure for early detection and diagnosis and an awareness amongst the married couples for screening before marriage. The minimum cost for sickle cell screening, testing, and screening is about Ugandan shillings 50,000, which is about $13 and it can go up to a maximum of 150 Ugandan shillings, which is about $40. I'm looking for a solution of developing a rapid diagnostic test for screening and early detection of sickle cell trait. I look forward to having the team to join me. Thank you very much.
Okay. Thank you. No solutions, no introductions. Okay, you can just say your name. Next, please come and register. Proceed and register your... Martin is there. He will be receiving you.
Good afternoon, everyone. I'm called Kamfachai Koro, and I'm here to present my problem. 2 months ago, I lost an aunt due to ischemic stroke that happened in one of her residence where no one was around. And it was a saddening moment for all of us all. And according to the Global Burden of Disease Collaborative 2020, non-communicable diseases like hypertension account for 42 million deaths globally. And 50 to 80% of these deaths occur in sub-Saharan Africa, with an estimated percentage of 22% in Uganda dying due to non-communicable diseases. And most of these deaths are due to ineffective monitoring of these patients and also delay in seeking of care for these patients. That is why I am here to come together such that we can hack solutions to monitor these patients effectively. Thank you.
Thank you. Next.
Good afternoon, everyone. I'm Cuthbert Ainembabazi. So the problem I'm interested in working on is the poor quality of healthcare in Uganda. This is probably due to the ratio of nurse to patient. So you may find that one nurse has to keep attending to 5 patients at the same time. So none of these patients will receive the general quality of healthcare that they deserve. I invite anyone who is interested in this problem to come and work with me. Thank you.
Okay, a hand clap. Thank you. Please proceed.
Good afternoon, everyone. My name is Victoria Nachito. During the COVID-19 pandemic, my mother got COVID. And because the bill was really high, we put the hospital in a very tricky position to give us the necessary care that we needed. And in Uganda, 43% of our population pay for their healthcare bills out of pocket. And only 1% of the population is health insured. So during pandemics, it's even very tricky for the insurance companies to cover such situations. So it becomes extremely tricky for families to manage the financial burden that comes with paying for healthcare services, but also very hard for the hospitals to provide the care that we need. So I'm here to look for a team that is interested in joining me so that we can work around the cost of healthcare and making it very simple for people to pay for the healthcare services, but also for the hospitals to provide for us the necessary care that we need without being financially burdened.
Thank you. Next.
2 years ago, I lost one of my youngest siblings to malaria. This boy had been hiding his symptoms for far too long. By the time we realized he had developed cerebral malaria, and when we took him to hospital, we lost him. But later on, we realized this boy feared the painful, invasive test for the current methods used for testing malaria. The methods of RDT, PCR, and microscopy tests are all invasive and involves taking of blood samples. I'm looking forward to getting a non-invasive solution for malaria tests and diagnosis. In this way, we would save far more lives than we all could imagine. Thank you very much.
Good afternoon, innovators. My name is Brian Rotomeo. I have the problem of disease infection from the patient to the doctors or the patient to the health workers, and I'm in need of a team. Recently, actually, there was a statistic or a news that was coming up about 5 medical doctors getting infected with Ebola virus, and the same thing happened during the COVID-19. So I think the solution for this is to actually get a remote system that would not involve direct contact of the medical personnel with the sick people. So the best thing I feel can be done is to actually limit the exposure time of the medical personnel with the people who are sick and having this infectious disease. Thank you.
Thank you. Please show your number as you present. People are going to look for you by your number. Please proceed and register your pitch.
Good afternoon. I'm called Gerard Mwevembezi, and 1.5 million people in Uganda are living with HIV according to UNAIDS 2021, and there are no numbers to uniquely identify these people. Like if someone lives in Mbara, they don't have any data to show that this person was enrolled on treatment, and they go to Kampala, they will just go to the nearest facility and test. If no one asks if this person had already been enrolled, they will just test and they are enrolled again. So this leads to increased numbers of new HIV infections being recorded, when actually it is not the case. It is coming up because we are having people who are already HIV positive, but they are retesting. So I'm looking for people to join me to look for a solution, how we can uniquely identify these people so that we don't have repeated testings. Thank you.
Thank you. Next.
Good afternoon, everyone. I'm called Nancha Shanita. I'm looking at the problem of period poverty that has become more rampant, especially in this period of pandemic. This affects the reproductive health and rights of women and girls. As of 2019, Ministry of Health stated that 1 in 4 girls in Uganda drop out of education due to menstrual poverty, and also 13% are diagnosed with UTIs, which is as a result of menstrual poverty. I'm looking for a team to work on a product that is sustainable, affordable, and readily available for the girls to use during their menstruation. Thank you so much.
Next, please proceed and register.
Good afternoon. I would like to begin my pitch with a short story. Yesterday, Mr. M, a 27-year-old border man, got involved in an accident. He was rushed to the hospital where he's required to do a CBC test, a blood test, and a scan, which costed 35,000 Ugandan shillings. He did not have it at the moment, and 10 hours later, he passed on due to underlying complications that were not identified. He died because he did not have a healthcare coverage. My name is Ishto Joseph, a 4th-year medical student at here, Mbara University. 12.3 million Ugandans live below the poverty line of $1.77 US every day. That is 2021 statistics from Uganda Bureau of Statistics. And these people, they are vulnerable and pose a heavy burden to our medical system. So I want to come up with a solution to provide a universal health coverage, insurance, medical coverage to the vulnerable people in our country. That's my problem, and I'm seeking a team of innovators to help me to achieve that.
Thank you. Okay.
Hello, everyone. I'm called Muisha Ediga, a 3rd-year electrical student at MAS. From a local survey done from one of the hospitals around Bahara, patients and patient caretakers always find it a problem to access special medicine and specialized medical equipment. So I'm here to look for a team to work on a solution to solve that problem.
Good afternoon, everyone. I'm Brian Kuba, a student at Kabale University. Many medical professionals, nurses, hundreds of them are contracting contagious diseases, COVID, Ebola, to mention but a few, and I'm looking for a team to work with to find solutions to that problem.
Okay.
Good afternoon, everyone. The world has endured a number of pandemics stretching from the 1st century up to date, the 21st century, with the current one being COVID-19, and they are not likely to stop. Unfortunately, there has been a shift in the focus about saturating and emerging strains, which leads to missed index cases that later leads to expedited transmissions and a menarche of mutant strains that compounds the challenge of ending or preventing pandemics. My name is Muhereza Dominic. I work in the CTU Yumba Regional Referral. I call upon fellow innovators to innovate about this challenge. Thank you.
Okay. Thank you.
Good afternoon. I'm called Julius Baguma. Usually, during pandemics, very many people in our communities are not informed. They are not aware of what to do, where to go. Recently, an Ebola victim, a patient, escaped from the hospital. He wasn't aware that he's spreading the disease everywhere. He escaped from the hospital. It was a lack of information. He didn't know what to do. I need a group of people who can join me, and at least we do teach the masses on what is going on. Thank you very much.
Good afternoon, everyone. I'm looking to solve the problem of people in rural areas are unable to access individual test kits, like for pregnancy, malaria, those common diseases. So I'm looking for a team of people that will help me come up with a solution that will help community health teams to be able to deliver these services to those people and better account for them. Thank you.
Good afternoon, everyone. I'm Grace, and I'm here to pitch on community health home-based care. My interest is that most of our people, directly or indirectly, are going into home care, of which most of us are candidates, or we have relatives who will benefit from that. And yet our healthcare system do not provide services for home-based care. So I'm looking for innovators who can help me come up with a service that we shall benefit from it directly or indirectly when that time comes. Because of the health challenges our people are facing, nobody to give them specialized care, they go to hospital late and so forth. Thank you.
Good afternoon, everyone. My name is Kopsinja Masi, and I'm a type 1 diabetic. I have had this illness for the last 12 years of my life, and 524 million other people in the world have the same problem. 2 million in Uganda. 1 in 20 people that you meet in this country are actually diabetic. I have problems. Sometimes I just collapse, and because my glucose level has suddenly gone down, and I did not know. Every time I need to know my glucose level, I have to prick, and because I don't have a glucometer, I have to go to hospital. I am therefore looking for people who can join me so that we hack this problem and make sure that we can have a system to continuously monitor my glucose and the many others, and also automatically intervene with maybe insulin or glucose without me having to lose it. Thank you so much.
Good afternoon, innovators. I'm called Sakoi Koi, and I'm a biomedical engineer. 5,215 Ugandans get cancer every day. In 2018, we lost 21,000 Ugandans. 32,000 Ugandans have cancer right now, and that is some of the cancers are due because of ionizing radiation. We have radiation generators in Uganda that cause cancer if you're exposed to overdose of radiation. So I'm looking for innovators where we can come up with innovation, how we can monitor the generators, ionizing generators or radiation generators in this country. I thank you. I'm number 19.
Good afternoon, innovators. My name is Isaac, and I'm a healthcare management student. It seems everyone is forgetting to talk about this. About 140,000 babies, newborn babies, die each year in Uganda. And these die because of preventable illnesses. And the baseline is mothers sometimes don't know what to do when the babies get sick at home. I'm here looking for a solution, and if you could join me, get a solution of supporting mothers in detecting illnesses and reducing the death rate of the newborn babies. Thank you.
Good afternoon, everyone. Good afternoon, everyone. Yes, my name is Keith Richard Kwagala. I'm a biomedical engineering student. My first question is, can we leverage technology in such a way that we can have medical sensitization of our population, down to even bus drivers, people that are not going to school? Why am I asking this? During COVID-19, we saw firsthand that our first line of defense was sensitization of the population. We had to sensitize people about sanitizers and widespread sensitization of this population. According to the study that was done by Public Health, we first had a very high surge because people were unaware of what COVID-19 was. But thereafter, doing sensitization at a slow pace, we were able to cap down these numbers. Now, I'm looking for a team that has the capability, and we're going to leverage technology in such a way that we are going to sensitize, have a ground where the entirety of our information is to enlighten the population using technology. Thank you.
Yes, good afternoon, dear innovators. I'm Octavius Nwazirwe, number 21. Yeah. Statistically, 70% of the population in Uganda here stays within a radius of 5 kilometers from the health facilities. This has become a challenge in a way that patients in the rural or peri-urban setting are not able to access health facilities in the real time. And this has led to vital tests among very many other Ugandans. Everyone is a candidate of death, whether rural or urban. So I'm looking towards getting a team of members that we can innovate a solution to decentralizing the healthcare system. Because the main challenge I have noticed is that the health system is more centralized, that yet it should be decentralized, yet since everyone is a potential candidate. Thank you so much.
Good afternoon. I'm called Musema Rogers. I'm a student pursuing Bachelor of Science in Civil Engineering. I want to talk about the mind, the human mind. A lot of people are going through stress, depression, anxiety, fear, and worry. So most people tend to ignore this. I know I might be speaking someone's mind down here. So I want you innovators to join my team. We try to cut some of these levels, at least we reduce it to some understandable levels so that our people can live with, can be mentally well. I just want to talk about the physical well-being, the social well-being, and the mental well-being. Thank you. I'll be happy to work with you.
I'm Jen, and over 15 million children in the whole world are born premature, and these numbers are rising in the resource-poor sources like Uganda. And one of the biggest problems that these children face is keeping their body temperature at a normal rate. And this is worse when they are being transferred from where they are born to the hospital, and even within the hospital, the facilities to keep them warm are not enough, and sometimes we even have unstable power. So I'm looking for a team that we could join and find a solution on how we can effectively keep these babies warm during transfer and even while they're in the hospital in a cost-effective way. Thank you.
Good afternoon. I'm Bako Lilian, number 23.
a student doing bachelor nursing completion at MAST. My problem is losing healthcare workers to epidemics. I'm a survivor of Ebola, and the memory of my colleagues, my classmates, can't go off my brain. The survivor of Ebola of 2000 in Lacho, I lost my close classmates to Ebola. And this morning, when I opened WhatsApp, the first thing I saw was we have lost a senior house officer, a doctor from Ubende. So this has really pained me a lot. I'm looking for a team to work together to see how we can come up with a solution to protect health workers from this pandemic, and see how we can improve on clinical suspicion and judgment. Thank you.
Greetings to you all. Bernard Kazwe is my name. In this era with emerging pandemics, we have an increase in the cases of litigation within healthcare facilities. Nurses and other healthcare workers are facing a problem of litigation where they lose their licenses, where they're imprisoned, and the major cause of this litigation is usually patient negligence. And this patient negligence, in most cases, is unintentional. So we are looking for innovators and all other providers that can enable us coordinate available resources, ideas, science, and technology so that we can develop methods of monitoring patients so that we do not lose the patients and we'll also sustain the health workers that are on duty. Thank you so much.
Good afternoon. My name is Komhanji Cynthia. In today's society, we realize that there are very many people who are depending on multiple medication to maintain their daily living requirement. This is due to the increase in pandemics and the other diseases that affect especially the seniors, for example, diabetes and hypertension. Due to people having busy schedules and forgetfulness, they tend to overdose or underdose, which leads to a lot of medication mismanagement. I'm looking for a team to work with in order to curb this problem. Thank you.
All protocol observed. My name is Amongin Deborah Jane. We lose about 44% to 85% of neonates every year in developing countries. And the price of infant warmers, they are very expensive. So I'm looking for a team to navigate around this problem so we can find a solution to decrease infant mortality rates in Uganda. Thank you.
Good afternoon. Vicky Harriet Anon are my names. There is a commonly use of unapproved abbreviations at the clinical practice in most health facilities that I have moved. That is affecting the quality of service delivery to our patients. Because sometimes you find a prescriber has used some abbreviation that is not commonly understood by all the teams, ending up somebody is given a different medication. So this one is affecting even the prognosis of patients. You find somebody delaying in the hospital just because of that. So I'm looking forward to having a team that will come up with a common understanding languages, and if possible, be forwarded to Ministry of Health that everybody has to use a common what? Term in prescribing, diagnosing, so that everybody understands. Thank you.
Good afternoon, everyone. Imagine you have a child who is diagnosed recently with a kidney disease. How would you go about it to ensure that you have proper medication? Which hospital would you need to go to, or which doctors would you need to contact? There is an information gap regarding how information is transferred from doctors and available resources to the patients. I'm looking for a team that will help us innovate around a solution which will improve information availability so that patients get to know which institutions can help them in a particular disease, and if possible, even doctors can find to know the patient disease history. Thank you.
Thank you. Good afternoon. My name is Abaho Crescent. I'm looking for a solution about repetitive and regular cases that are always handled by medics in hospitals. Which cases are treated in the same way? For example, I can say malaria or typhoid. You get similar cases, but they are treated in the same way. And the medics we are having are limited compared to the patients they attend to. So I'm looking for a group of innovators to help me get a solution to that problem of treatment of regular and repetitive cases that have the same treatment. Thank you.
Yes, good afternoon, everyone. I'm Mokwaya Pius, biomedical engineering. So over the years and currently, Uganda, we are faced by a number of pandemics such as COVID-19 and Ebola. However, the Ministry of Health recently admitted that the biggest challenge they are facing to reduce these pandemics is a problem of contact tracing. So I'm looking for a way of innovating.
Thank you. Because of the COVID-19. And indeed, a lot of people, investors, and industries contributed. And in this, it was not only done in Uganda, even other countries, people were contributing towards the cause. And here I am, looking for the team of innovators, people down people, so that when they are willing to donate to the government, they can do it.
From complications related to pregnancy and childbirth. Do you know how much that means? That's around, it has been indicated that the maternal mortality rate has services so that we can curb down this maternal death. Thank you very much.
0.2% of the population living with chronic respiratory diseases. In COVID, Africa lost 52% of these people who were taking treatment because they couldn't access health services.
That are affecting their health in terms of shivering, the discomfort, and it's actually delaying also the initiation of breastfeeding of their babies. I mean, maternal hypothermia is causing more complications like surgical site infections, prolonged wound healing, and all these are actually affecting their health. So with the unsafe ways of warming these mothers during surgeries, for example, just boiling water and warming fluids, trust me, this is an unavoidable certainty in Uganda and in our low-resourced surgical wards. So we should come up as a team and work on it.
Good afternoon, everyone. My name is Mary Anthony Naseje, and I do biomedical engineering, year 3. Yes. Around 2018, my grandmother was diagnosed with cancer, and she was taken to the hospital in a health center and they placed IV infusion on her. They were chemotherapy drugs, and around 3 a.m. in the night, the drugs got done in the IV bag, and we were there looking. We didn't know what to do. All we saw was blood leaving her body and going back to the catheter. And slowly by slowly, she became weaker and weaker and died. And because we tried calling the nurses were not here. They were nowhere to be seen, and maybe because of the workload they had. And therefore, I'm here looking for a team that is going to help me bridge a gap of communication between the nurses and the patients to avoid these deaths. Thank you.
Thank you, everyone. My name is Kaites Aisha. And in Uganda, we have over 6,000 health facilities. 43% of these health facilities suffer stockouts. Why do you think this happened? It happens because of the poor inventory management systems, these stockouts that these health facilities have, that will come up and join me to work on a solution of that problem. We spend a lot of money on banning these expired drugs. Almost 1 billion is spent to ban the drugs every year. We have so far banned over 1,000 metric tons of those drugs. Thank you very much. Join me as we look for a solution.
Good afternoon, everyone. I'm Martha Macklin Namayanja. Over the years, a number of people get hospital-acquired infections. These are gotten when you go and the wards are overcrowded. you end up getting an infection you did not come with to the hospital. This leads to long-term overstay in the hospital, and inaccurate diagnosis and death sometimes. Ladies and gentlemen, join me as we hack around this problem. Thank you.
Hi everyone, I'm called Henon, Year 1 Medicine. Uganda's maternal mortality rate is at 368 deaths per 100,000 live births, while the infant mortality rate is at 19 deaths per 1,000 live births. So research shows that these deaths are usually caused by 3 delays: the delay in seeking health care, the delay in reaching the health facility, and the delay in giving the appropriate treatment, which includes referral. So I'm looking for a team that can help me to tackle all these 3 problems so that we can reduce these mortality rates. Thank you.
Hello everyone, I'm called Datayara Gift, a physiotherapy student here for. From my placement at Mbara Regional Referral Hospital, there are many traumatic brain patients secondary to road traffic accidents, and as a result, they have many disabilities, such as difficulty to walk and also do the activities of daily living. And because of their increased numbers, there is also limited space, so when they are medically stable, they are discharged without actually getting enough rehabilitation that they could maybe help them to have a better quality of life. So I would like a team that will join me to work around this problem so that even when they are discharged, they can still access rehabilitation services. Thank you.
Hello, Ian Ricky from Doctor. Uganda expresses 75% disease burden with full OPDs and inpatients. So I look forward to a team of software developers and resources to decongest OPD and inpatients by developing a hybrid system and AI enabled to curb this. Thank you.
Good afternoon, innovators. I'm Calvin Elvis Owili, civil engineering student. It's very true that many people in Uganda die as a result of improper response to emergencies, especially for the people living at rural areas due to lack of proximity to the health service centers. So I'm here and I'm looking forward to developing a team that will come up with an inventive solution and a rapid emergency response format for helping people living in the deep rural areas of Uganda to access services at grassroots before being transferred to the main referral unit so that this number of deaths due to emergency.
Good afternoon. You have symptoms, maybe pregnancy, HIV, something like that. It's easier for you to go on Google and do that and search for the signs, so you will take caution immediately after that. But what happens is that people in rural areas don't have anything they can use, and usually it's difficult for me to go to the hospital and be like, maybe I have HIV, things like that. There is a bit of insecurity in technical areas because they don't have smartphones.
Hello, good morning. Medical era is one of the leading to attend to this, and when CPDs when they are organized during the day, or when professionals are very busy, they don't have time to go and attend them, and in the long run, they commit errors. So I'm looking at innovating around building a centralized system that is certified so that you can sit anywhere and attend a course and get certified. Yeah, that's what I'm looking at, so that we can read this.
I am Mauma Eunice.
When I was in senior 2, one of my classmates had to go through a series of go to this drug, and change to the other drug. At the end of the day, she developed a chronic condition. So I'm looking for a group of engineers and as well as innovators who will help me fight this, should I call it a condition of misdiagnosis, which leads to misprescription of drugs by the healthcare systems. I really want to fight the trial and error means of treatment that we experience in our healthcare facilities today. Thank you so much.
Problem, lack of effective communication between or among the disability people and the normal people. Panel. My name is Barbara Noabaine, doing Bachelor of Computer Science, majoring in Cybersecurity and minoring in Artificial Intelligence and Machine Learning. According to the statistics, over 1 billion of people of the world's population are disabled. And here I mean, we have the deaf, the dumb, the blind, as well as the handicapped. And I am here looking for a team to work with me for creativity and using the available technology to overcome the situations they face, especially as a result of their disability, because they come across adverse socioeconomic outcomes. Thank you.
Good afternoon, everyone. Geoffrey Kewaza is my name, and I'm number 48. In 2019, there came up a pandemic we all know as COVID-19 and put the world to knees, all sectors, economics too. Right now, Ebola has come up in Uganda and no one saw it coming also. Something came to my mind and was like, what if someone saw this coming and they told us before? How would it be if someone could forecast a pandemic before it came up? How would that be? How many lives would be saved? So here I am looking for a team of passionate innovators. We come up with a system that can help us forecast a disease. We see weather forecasting, tornadoes are being forecast before they happen. How about if it happens to a pandemic? Thank you.
I'm called Asime Robert, I'm number 50. Currently, the methods of diagnosis include invasive methods whereby the patients pass through painful piercing and sometimes may cause bruising, bleeding, unnecessary bleeding, and sometimes it might even cause other problems. And even it becomes a very challenging issue when it comes to babies, whereby you can't easily locate the vein of a baby to get the blood out so that you start diagnosing for any disease. And you find that sometimes the baby has a cannula in their head because it's where they could locate their vein. So I'm looking for a team of special people to help in using machine learning to image blood for any diagnosis of any diseases, so that we can always find solutions to this, to finding diseases.
Good afternoon to you all. My name is Christian Paranoelin. In May 22, the Ministry of Health issued statistics that 14 million out of the 43.7 million of the population are mentally ill. And I bet most of us here are potential candidates or indeed are mentally ill, but we do not know about it. Yeah, so I'm looking for a team of innovators that can help us reach out to the people, because most of us, despite the depression, but we are embarrassed to talk about it to the psychiatrist, that can help us reach out to the people and even to the least person, that you can reach out to them in their homes. Thank you so much.
Hello everyone. I'm called Daniel, and Daniel Nasasira, and I'm a software engineer at the Apache Software Foundation. So I was here, and one of the problems that was said were nurses are not involved in policy making. So I'm here to look for a team and innovators to actually tackle that problem. Thank you.
Good afternoon, everyone. Amos Oyuru is my name. I'm a pharmacist. Imagine you're admitted to the hospital and for lack of a better word, the strongest drug fails to cure you. What would you do? So this phenomenon is known as antimicrobial resistance, and it's a silent pandemic. It's projected that by 2050, more than 10 million deaths will be due to this. So I'm looking for a team of people who are passionate about this to work with so that we prevent that from happening. Thank you.
I don't know whether it's good afternoon, everyone. I'm Sebulio Riganashavin. You realize apparently in Uganda we have around 50 radiologists. 50 radiologists in the whole Uganda. These are people who are actually expected to do diagnosis of illnesses and perhaps sometimes do treatment of these illnesses. But you find there are very few. If in a ratio form, you could actually find the radiologist to patient ratio is around 1 to 1 million patients. So you find that for every 1 million patients in Uganda, we have only one radiologist to do the diagnosis and all that. So let's not underestimate the power of AI and machine learning. Can we find a group of innovators who can actually come up with models that can do auto-detection, diagnosis of different pathologies of the body using different machine learning models? In addition, we could also look at anatomical landmarking of different organs in any particular part of the body. It could be the brain, there could be the abdomen, anywhere in the body. Let's not underestimate the power of artificial intelligence. Thank you.
Yes, good afternoon. Several admitted patients normally escape from health facilities. Even sometimes patient conditions worsen without being noticed. This is because of the poor monitoring system. And also, for the escape scenario, normally it is difficult for these patients to be followed up. A similar scenario happened during the pandemic when a reserve was set up at Entebbe and several incidents were registered for patients escaping from the reserve. So I'm looking for ways of ensuring a proper way of monitoring patients and their records in the hospital so that they can be followed out appropriately. I'm looking for a team of innovators who can work around that area. Thank you.
Good afternoon, everyone. My name is Rukwata Godfrey, a student at MAST, and I'm in my third year doing BBA. My problem is mental health illness challenge among the youth. Uganda's population is highly composed of the youth, but according to the Uganda Counselors Association, the youth have been reported to be having the highest rate of mental illness disorders, amongst 21% of depression, 26.6% of anxiety. This affects their way of behavior, thinking, and acting. And the existing cope-up measures which they use, such as drug usage, alcohol, have proved of no remedy but to worsen the situation. So I'm looking for a competent team to join me, and we provide a system or a solution that can help us cope up with the situation, since the youth are the future generation of this country. Thank you.
Good afternoon, everyone. My name is Atima Ngolona, a fourth-year medical student at Bara University. We find that emergency response within our communities, especially in the rural areas, is very low, and basic CPR knowledge is also very low. CPR is cardiopulmonary resuscitation, and we realize that 50%, we have a 50% recovery rate on CPR, and yet only 1.6% of patients receive that CPR. So I would like to find an innovative way alongside a team that can help us integrate CPR knowledge within all systems of our care, from lower primary education to the senior levels of our society. Thank you very much.
Good afternoon. My name is Bena Mule. I'm number 57. So the challenge for me in Uganda, VHTs were introduced solely for the purpose of reducing maternal and infant mortality. Most times we see mothers coming to, let me say, to the health center with complications, but it's not timely. So I was looking for a team that could introduce some sort of triage to be used by VHTs to identify mothers who are at risk, because you know not all these mothers come for antenatal. So we get a triage for these VHTs to use to identify mothers that could be at risk and give them timely referral. Thank you.
Hello, everyone. My name is Musingozi Ethan, and I'm number 58. So the challenge I'm trying to solve is forgetting your medicine at home. So if I'm a primary child, which I am, and I have diabetes, and I forget my medicine at home, that will be really bad because, first of all, my blood temperature will go up, and then I'll become really sick. And then my mother will have to waste her time and come and bring the medicine. So what we are trying to solve is not forgetting that. Thank you.
Good afternoon, everyone. My name is Trifin Nyakecha. I'm a third-year biomedical engineering student. I would like to interest you in the fact that every second lost in the management of an emergency could culminate into the death of a patient. And so in line with this year's theme, which is building a resilient healthcare system, I would like to implore our team to come so that we can think of a solution to help in the management of emergencies, from lower healthcare systems to much more generalized healthcare systems. Thank you.
Good afternoon, everyone. My name is Ilemut Ivan. I'm an electrical engineer by training, and my number is 60. I come from a family where we have 5 sisters, and it so happens that on a monthly basis, they get infected with UTIs. And this costs us not at least 100,000 shillings for each of these girls. I'm looking for a team that can join me to develop a simple solution, probably a spray that our sisters, our children, our mothers can use when they go to places of convenience to reduce the spread of UTIs. I call upon a team to join me in saving our sisters. Thank you so much.